Chapter 1. You're not imagining it. Understanding lichen sclerosus. If you're reading this, chances are you've experienced itching, soreness, pain, or changes to your intimate skin, and maybe you've been told it's just thrush, eczema, or all in your head. Let me start by saying this. You are not imagining it. Your symptoms are real and they matter. You matter. Lichen sclerosus is a chronic inflammatory skin condition that most often affects the vulva in women, although it can appear in other areas and affect people of all ages and genders. Despite its life-altering impact, it's still not widely recognized, even among healthcare professionals, and many people suffer for years before receiving an accurate diagnosis. What is lichen sclerosus? Lichen sclerosus causes thinning, inflammation, and white patches of skin, most commonly on the vulva. It can lead to intense itching, discomfort, tearing, and pain, especially during sex, toileting, or daily movement. Over time, it can cause scarring and structural changes if left untreated, but with proper care, it is manageable. LS is not an infection, it's not contagious, and it's not caused by poor hygiene. Most experts believe it's autoimmune in nature, meaning the body's immune system mistakenly attacks its own skin cells. Hormonal shifts, genetics, and trauma to the skin, like friction or injury, may also play a role. Why is it so often misdiagnosed? There are a few key reasons. Lack of awareness. Many GPs and nurses are unfamiliar with LS, especially in its early stages. Shame and silence. Because LS affects intimate areas, many people hesitate to speak up or seek help. Similarity to other conditions, LS can look like thrush, dermatitis, or lichen planus, leading to misdiagnoses and ineffective treatments. Not alone if you've been dismissed, misunderstood, or misdiagnosed. I hear you. So many of my patients arrive at Elite Aesthetics feeling exhausted and defeated, having been passed from doctor to doctor without answers. By the time they receive a diagnosis, they've often endured months or years of unnecessary suffering. That's why education is so important. When you understand what's happening in your body, you can begin to reclaim control and find hope. What this book will help you do over the chapters ahead, you'll learn how to recognize and manage symptoms, what treatments are available, both NHS and private, how to advocate for yourself in a medical setting, how LS affects mental health, sex, and relationships, how to live confidently and fully, even with a chronic condition. You are not defined by your diagnosis, and you're not broken. With the right support and care, healing emotionally and physically is possible.